A turning point for vaccine policy in the United States may be unfolding right now, and it's raising eyebrows across the medical community. The US Centers for Disease Control and Prevention, CDC, is set to welcome 5 new advisors to its influential vaccines committee this week. And their selection by the CDC and the Department of Health and Human Services, HHS, has stirred considerable debate. Why? Many believe this signals a hard shift toward vaccine skepticism within circles long viewed as guardians of public health. But here's where it gets controversial. Several incoming members not only lack significant expertise on vaccines, but some have a well-documented history of questioning the safety and efficacy of vaccines, or established practices in infectious disease control. Critics worry this could fundamentally reshape vaccine policies at a time when confidence in public health is already fragile. This shakeup follows the resignation of several respected CDC leaders who allege they felt sidelined or even pressured to support decisions they saw as disconnected from sound science. Major decisions, including those related to COVID vaccine distribution, were cited as areas where scientific rigor fell by the wayside. Tara Smith, epidemiologist at Kent State University College of Public Health, didn't mince words. It doesn't look like vaccine expertise drove these appointments. Instead, it seems their vocal skepticism, especially regarding COVID vaccines, propelled their selection. Her concern? These figures could push to further limit vaccine access, something on the committee's very agenda. Jessica Steyer, a public health scientist and founder of Unbiased Science, pinpoints the real issue. The pattern here isn't about 1 or 2 individuals. It's about systematically replacing experienced vaccine specialists with people who've cast doubt on well-established science. She warns the timing is dire, as outbreaks of measles grab headlines and respiratory virus season lurks around the corner. Policy changes rooted in misreading data could have immediate and potentially devastating real-world effects. Even if the new committee ultimately continues to endorse vaccines, Steyer believes that public expressions of skepticism do serious harm, sowing seeds of distrust and confusion. And this is the part most people miss. This week, the Advisory Committee on Immunization Practices, ACIP, is scheduled to vote on 3 major vaccines: the combined measles, mumps, rubella and chickenpox shot, the hepatitis B vaccine for newborns, and the COVID vaccine. The implications are massive. These votes could limit parental choice, Steyer explained. If ACIP won't recommend certain vaccines, insurance may deny coverage. And programs like Vaccines for Children could halt support, leaving families without key protections. A former top CDC vaccine official recently cautioned that delaying the hepatitis B vaccine from birth to 4 years old could reverse hard-won progress in disease prevention. With hepatitis B infections among American youth down by 99%, pulling back on these early interventions could reignite transmission. The committee is also poised to potentially narrow COVID vaccine recommendations even further. Steyer voices concern that unverified adverse events, like those from the Vaccine Adverse Event Reporting System, VAERS, could be misrepresented as confirmed vaccine-related deaths, a fallacy she compares to treating every 911 call as indisputable evidence of a crime. Now, let's meet some of the new advisors sparking this debate. Several have a history of opposing vaccines, especially in the context of COVID. For instance, Catherine Stein, a professor at Case Western Reserve University's School of Medicine, wrote in January 2021 that her Christian faith teaches her not to fear diseases, using religious reasoning to reject mask wearing and social distancing. She considers masks not just useless, but actively harmful, a claim widely debunked by scientists. Stein is also affiliated with Health Freedom Ohio, a group aligned with Children's Health Defense, an anti-vaccine organization previously led by Robert F. Kennedy Jr., who currently heads HHS. In 2020, she co-signed a letter urging then-President Trump to reconsider mandatory vaccination policies in schools and to oppose what she called the persecution of unvaccinated believers. Then there's Dr. Kirk Milhoan, a pediatric cardiologist who opposes COVID vaccines over the extremely rare risk of heart inflammation, myocarditis. Milhoan is also associated with the Independent Medical Alliance, a group that, under a prior name, promoted unproven and sometimes dangerous COVID treatments like ivermectin. The Hawaii Medical Board has investigated his license multiple times, though it remains valid. Evelyn Griffin, once an OBGYN and now a proponent of holistic health, recently argued at a health freedom event that doctors too readily trusted the safety of vaccines without questioning them. She's appeared in webinars critiquing vaccine mandates for children and sharing anecdotes about treating women she claims suffered after vaccination. There's also Hillary Blackburn, a pharmacist and relative of Senator Marsha Blackburn, who has hinted at possible links between vaccines and autoimmune disorders. Raymond Pollock, a transplant surgeon, rounds out the group, though little public information is available about his vaccine views. These 5 will join 8 other advisors installed by Robert F. Kennedy Jr. in June, after he took the unprecedented step of dismissing all 17 previous committee members. Alarmingly, watchdog group The Evidence Collective has already flagged over 50 pieces of misinformation in just the committee's first meeting after the shake-up. With the vaccine committee's ranks potentially expanding to 19 members and 6 seats still open. Some worry about what further changes may come. Traditionally, the selection and onboarding process for these high-stakes roles takes months or even years, but things are moving at a record pace. So here's the big question. Is bringing in more voices skeptical of vaccines a necessary corrective to groupthink, or a dangerous detour from science-based public health? Do you think fresh perspectives might help or harm the CDC's mission? Should vaccine advisory groups require deep subject matter expertise, or is it fair to represent a broader range of opinions, even if some are controversial? Let's hear your take. Join the conversation below.